A thread nose lift is theoretically possible. Of course, I want you to know that this has very, very limited indications when we evaluate Turkish society in general. Only in cases involving the nasal tip and in situations where the deformity is very, very minimal, even in an office setting with very tiny local anesthesia, it can be done. However, lifting the nose tip with threads is a procedure whose reliability rate is slightly lower theoretically due to the prominence of cartilage memory. In these cases, tip Rhinoplasty, averaging 20 to 25 minutes. The permanence rates for the nose tip aesthetic, which we call Tip Plasty, are much, much higher. The patient can return to social life in 2 to 3 days. Since they can return to work, we can suggest nose tip aesthetics for patients with reliability concerns about thread lifting. To that option. What is important here, as I mentioned, are the patient's examination findings, which are very, very important. If there are only very minimal problems with the nasal tip, then we can prefer the thread suspension technique. If the issue is slightly beyond minimal, performing tip plasty surgery is easily done without stressing the patient, without causing the patient too much distress. In any case, based on your examination findings, we can resolve this issue of yours either with the thread nose tip lifting technique or with tip plasty.